Hello, everyone. Welcome to the Lagos Moms and Lakeshore webinar, where we are going to be talking about the relevance of routine cancer screening in overall health and well-being. My name is Nifesi, and I work as a programs manager at LagosMums. LagosMums is a community, a resource for parents, caregivers, everybody who is a stakeholder when it comes to parenting. We share all the information and all the tools that you need to be an effective parent, especially in today's digital age. So you're welcome. We appreciate you for taking time out to join us today. And from Lakeshore Cancer Center with me today is Dr. Oge. Dr. Oge, can you kindly introduce yourself so everybody can get to meet you?
Okay, thank you very much, Nifesi. And as you've mentioned, my name is Dr. Oge Ilegbune. I'm really excited to be here because I follow Lagos Moms. This is a real pot of information for virtually everything. So I feel very honored to be here today on the other side as a speaker. And so I'm a family physician and I work with Lakeshore Cancer Center. In addition to a GP clinic, then it's actually medical clinic. And at Lakeshore, which, today's focus is on cancer, really. I'm the head of the strategy development and outreach. And really, simply put, my role is to increase awareness, promote education around cancer, everything cancer, whether it's the screenings or it's preventive, or even for some population treatment, what treatment modalities there are. But I'm not an oncologist at all. So I just wanted to make clear that I am a family physician. Thank you for having me.
All right. Yes, we are very, very glad to have you, Ma. So let's go straight into today's conversation. We're talking about the relevance of cancer screening. And a lot of people hear about cancer. But apart from the fact that a lot of people know it's a terminal disease, most people do not know other than that. So what is cancer?
Okay, a very good question. And of course, in the context of cancer, the concepts we've come from, health and well-being, I'll define cancer and define what it is to even be well. So we do know that cancer is uncontrolled division of abnormal cells in the body. So what do I mean by that? If you remember in your biology or integrated science class, secondary school, even to a degree, primary school, we were taught that the body is made up of cells. As you see us here, we are made up, every part of us. And normally the cell cycle takes the same, birth and then death that we know when we are born and we die. At the cellular level, that's really what happens. But what then happens in cancer is that cycle is disrupted for a number of reasons, all the risk factors we might eventually touch on. And instead of the cells eventually getting to their end of their life cycle and dying, they hang around. And as they hang around, they start causing all sorts of problems. They either form a lump, which is when a woman would say, oh, I felt a lump. Or they disrupt the function and people say, oh, this is happening and I can't, like some of the blood cancers, you don't find a lump, but you notice that the blood counts are low. And so the more, worrying aspect of cancer is not just that they cause this, but their ability to move from one local area to another. So, the surgeons are always pleased when we contact them and they say, is it local? Is it still local? Local means that they can just go there and take the cancer out, the abnormal cell out. But when it spreads, it's left the breast and it's gone to the back, the spine, it's gone to the liver, it's gone to the lungs. That is a presentation that actually has given rise to this concept that cancer is a death sentence. But actually, that is not true. It's always, depends on the stage at which the patient actually presents. And we'll talk more about early detection as we go along. So in a short, just to summarize, cancer is really when you develop abnormal cells that begin to cause problems, and in some cases, they leave point A and go to point B and C.
Wow. Thank you. I never knew that until you said that today. I thought, oh, once it spreads, then that every cancer is always at the spreading stage. But thank you for clarifying that for us today. So one of the reasons why we are having this conversation is because on the 4th of this month, February, was Cancer Awareness Day generally in the world over. So, and the theme for the month was closing the care gap. So can you tell us a little bit about that, the theme of the month for the cancer awareness, closing the care gap, what that means for us?
Thank you very much. This World Cancer Day, 4th of February, has become actually a very emotional thing, you know, as the years have gone by. It started off at a summit, a health summit in Paris. And really, the whole idea was, you know what? We've realized that there's inequity of health all around, in addition to the cancer space. And so there was a charter, you know, a charter is like a promise of about 10 different articles that said, these are the things we have to do to close the gap, to make sure that every single person on this planet gets care, gets diagnosed, gets treated. And that is how World Cancer Day actually started, 4th of February. And some organizations took it on board. So there's an organization, the UICC, then started driving it, increasing awareness and getting partner countries to sign up to it. And so you normally have different themes as the years go by, but in 2022, it was decided that in view of what was happening, that the close the care gap was really the key message we wanted between 2022 and 2024. So the same theme has been running since 2022, and it will continue till next year. And the whole idea is that we have to find strategies where, you know, to overcome the challenges and the barriers. That means that the person in Alaba or the person in Gambia or the, you know, just think about it, that depending on where you are, you won't have access to healthcare. You will not get screened. You will not get diagnosed. You will not get treated. You will not get vaccinated. And so the voices started, you know, in fact, the interesting thing is that since this closed the care gap, it's not just the oncology space anymore, you know, the cancer, very small cancer space. Other health organizations have taken up the mantra, just because cancer is health. So you can't segregate and say, well, the oncologists and the oncology organizations should handle this. It's become something that has developed a force of its own. And I think that is why so many organizations, LagosMums, everybody is hearing about it. 2 years ago, it was difficult. In the cancer space, yes, you would know, oh, it's World Cancer Day. But now everybody was talking about it in schools. You know, our Foundation for Cancer Care actually went to one of the private schools because they declared the whole week a cancer drive to commemorate this. So that's the background.
Thank you so much, Ma. That was very, very good. And I love the fact that you mentioned that the theme helps to spread the awareness for the cancer message. So it doesn't matter if you're a market woman in Alaba or you are somebody seated in Chevron, you can still get to hear the message and, you know, get enough adequate care as much as you should. So the next question is, can you give us a holistic definition of good health and well-being? Because you mentioned something when you were answering the last question, that discussing cancer is no longer just in the oncology space. It's also a part of health. So what does it mean? What does health mean? What does good well-being mean?
Okay, thank you very much for that question. Again, this is a nostalgic one, and I'll explain to you. The WHO definition of good health and well-being is one that in medical school, in nursing school, you know, it was one of those definitions that they just touch you and you begin to parrot it, you know, whether you crammed it or you didn't cram it. And it was only years later that most of us who went on to practice realized the real significance of that definition. And I'm going to take it slowly. It says it is the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. What is that saying to us? It means that being in good health, having feeling good within yourself, doesn't stop at your physical health. So you don't have a headache, you don't have malaria, you don't have diabetes, you don't have blood pressure, and that's where it ends. Increasingly, we are realizing that actually, if you're mentally unwell, you are not in a state of good health or well-being. If socially you have some, difficulties that worry you, you're not sleeping well, you're not in a state of good health and well-being. And even more important, the fact that you don't have an obvious disease, an obvious infirmity, doesn't mean that if you are then screened, that people will not discover, your doctor might not suddenly find out there's something wrong. So for example, there are people who go, they're getting around, there's nothing wrong with them. And then suddenly their company says, oh, we now have HMO, everybody in this company must get their annual health check done. And suddenly they come to us, I put on the blood pressure monitor, and the person in front of me, looking fantastically well, has a blood pressure of 180 over 110. And what then happens is we get all this information about suddenly somebody slumped and died. And people said, but nothing was wrong with the person. They were fine. I even saw that person yesterday. They even played golf. They even did this. However, within the body, something was already happening. And the fact that there was the mere absence of disease and infirmity did not actually translates to the fact that the person was in good health. And over the years, since this definition has come about, there are now several elements around it. So before, it stopped at physical, social, and mental. But now, depending on the context, we actually have about 5 to 8 elements to it. So nutritional, emotional, spiritual, your spiritual health, intellectual health, your financial health, your environmental health. How many people living in Lagos can say they actually feel very well when they have to wake up at 4 a.m. and get to work, and then the whole cycle begins again the night in the evening? Most people spend nothing less than 3 hours on the road. That is environmental. You're in traffic, you're abusing people, and people are abusing you back. You cannot be physically, you cannot be, in good health and well-being. So this is the way we are now breaking down the definition of good health and well-being.
Thank you so much, Ma. That was so holistic. You mentioned something that health isn't just about your just the physical health alone. Your mental, financial, spiritual health is also a thing. There was a point you made where that you said sometimes people don't know that something is wrong with them until they actually go for screening. Because I experienced that personally. Somebody very close to me, we didn't know that anything was wrong until one day she was very weak and tired. And we just said, oh, let's take her to the hospital. And by checking her blood pressure, we found out that it was over 240. It was really terrible. It was a terrible time for everybody in that period. So that's also very important. Constant and continuous screening. So when it comes to screening, what is both general and, cancer screening as well? What does that mean? How is that done? Can you share more with us about that?
Certainly. So screening actually means that you're trying to detect potential health disorders or diseases in people who do not actually have any symptoms of disease. So what I'm trying to say here is you cannot say that somebody is going for screening if they feel unwell. They have to be well, at least apparently to themselves, and they are just going as a routine. Nothing is wrong with me. I just want to go and do my blood pressure. I just want to go and do my breast examination. You must apparently in your own books feel well. If somebody appears at a hospital to say, I felt a lump in my breast, or I just feel unwell. Can you screen me? That is not screening. That becomes diagnosis, because the doctor, the nurses, the clinic is trying to find what is wrong with the person. With screening, you are well. It is done potentially. In other words, we're just trying to find out, is there any problem? And if there's any problem, what do we do about it? And so this definition of screening covers both general health screening and even cancer screening. So with the general health screening, now that, we've become sort of slightly more advanced with the HMOs and all that, you sort of see the list of a few things, even though that's a conversation of another day. There are some tests being put in by the HMOs that, to be honest, don't necessarily constitute screening, but at least the basic, okay, let me go and do my blood pressure. Let me check my weight, do my waist measurement, because obesity is a risk factor for most things now, most diseases. Let me do my blood sugar test. Let me do my kidney test. Those basic ones are general health checks that you can do. And these are physical, remember, we're still talking physical. Now, for the cancer screening, there are only 4 cancers that you can actually screen for. Over the years, you have so many cancers, but when you talk about potentially trying to find something, there are 4 cancers: breast, cervical, prostate, and colorectal. So these are screening. Now, it's now for the doctor to then add some elements to the screening. So for instance, if somebody said to you, I'm coming for my annual general health check, they should come to you for a consultation. You have a chat, you get a background, you have the basic ones, but depending on what the person also tells you about their past history, you might decide to add 1 or 2 extra things. And you must always ask them, and how are you today? How do you feel up here? How do you feel up here? Emotional health and mental health. Because if you remember, we said the definition of health didn't stop at physical anymore. It's expanded. So that is screening in a nutshell. And I will probably just lead up to the next question which you might have, which is, so what is the goal of screening? Why are we, doing this thing that people sometimes tell you, it's not my portion. I don't want to find out. Why are you trying to get me to see a doctor? You want me to die before my time? What is the whole point of screening? So one of it is early detection. You want to find things out early. And well, I'll tell you why. The other is lifestyle changes. So if I go to my doctor and my doctor tells me, Dr. Oge, and yes, I am registered with a GP myself. I do not treat myself. So when I go for my own annual check and my doctor says, you are overweight and you know the risk of being overweight, it helps me, motivates me to start changing my lifestyle. Do I need more exercise? Do I need to change my diet? Do I need to sleep more? Because the lack of sleep can can affect your weight. And then surveillance is the other goal of screening. Surveillance meaning monitoring. And the whole idea of these 3 things is to reduce risk factors when they are found and to treat when something is found. So if I go to my doctor, so for instance, the example you gave, your personal example of the relative who was found to have 200 and above and all, I am sure at that point, the doctors then obviously started him or her on drugs. And it's the same for people who don't even have symptoms. If you go to the doctor and they find out that there's XYZ, then they either give you lifestyle changes or they treat you or they say you have this. And it's the same with cancer. With early detection, if something is found early, the doctors have a higher percentage of being able to treat you and for you to be able to carry on with your life.
Wow. Thank you very much, ma'am. Thank you very much, ma'am. So speaking about screening when it comes to cancer, preventive screening, at what age should we consider screening? Because some people feel like, oh, I'm still young, and some of these diseases are for grandmothers or older people. It shouldn't affect me. So at what age should an individual consider preventive screening?
Okay, that's a very good question. And I'll tell you why it's a good question. It's a good question because sometimes people are a bit confused. It's not really been explained. The whole idea around screening is that it's age dependent and it's gender dependent. So if you have a man, the sort of screening test that you would obviously recommend would be slightly different just because he's male. There are some things that will be the same as a woman, but there are some things that will be different. And the age is also very important. There's also one other significant element to screening. It's also what your family history tells you. If you have a family history that says there's breast cancer, it already changes the age that you will screen, different from the next person who has no family history. So we've already mentioned that there are 4 cancers that are screenable. And for each one, there's a different age for it. So let's take breast cancer, and I'll be slightly quick and snappy with it. Breast cancer, as far as you have developed breasts, you can actually wear a sports bra or a normal bra. You need to start doing breast examination yourself. The whole idea is that you're learning your own breast so that if there's a problem, you will know and you can go to the doctor and explain properly, or a nurse, what the problem is. If you don't know your breast, then you get confused when there's something. It's just the same way we know our face. Once I have a pimple or something, I already can tell. If you're telling me it's not there, I'm like, no way. I saw this, it wasn't there 2 days ago. So even my daughter, when she, started buying bras, I had to teach her how to examine her own breast because I won't always be there with her. Now, that's it. So breast examination by self can start at any time once there's breast visible. Then, as you get older, about your mid-30s, you should then, at this point, be registered with a clinic and with a GP. And once a year, you need to come and they need to examine it for you, a more objective examination. Someone will do that for you. And then when you get to the age of 40, you have what's called a mammogram. A mammogram is a low-dose X-ray that penetrates even more than your hands to check if there are any lumps or anything. The whole idea of the examination is to also check, are the breasts the same size? Is there a sore? Is there a discharge from the nipples? There are all sorts of things that come about during the examination because most people focus on breast lump as for breast cancer, but actually you can present with breast cancer and you've never felt a lump. So that's the whole idea. Now, if you have a family history of breast cancer, your mammogram is done earlier in your 30s. Okay, so it's a discussion with you, between you and your doctor. There's so much I could say about breast cancer, but let's go to cervical cancer. Again, it's the same, age, and it's for females. So you can see where the gender is coming in. For men can actually have breast cancer, interestingly. I'm not sure how many people realize that. And sadly, because men don't actually have breasts that they can feel, the men present mostly in the late stages. By then, it's spread. So we always say to men, especially men who have family members, female members, that there's a high risk of, breast cancer in the family. Just press your chest. Just check your armpit, check under your collarbone, especially if you have the family history or genetic, predisposition. And then for cervical cancer, again, once you start having sex, actually, it doesn't matter if you had it once, it doesn't matter if you had it some weeks or years ago. Once you are sexually active, we actually advise that you add 3 years to your first year of intercourse, and that tells you when you should ideally start having your cervical cancer screening done. Now, the general rule of thumb is from the age of 21, you must at least have started having your cervical cancer screening right up to the age of 65. And again, this is broken up into different elements. You have what's called the HPV DNA test, because 99% of cervical cancer is caused by a virus called the HPV. I think most people are beginning to hear about HPV. It's normally a very harmless virus. The body is able to clear it. But in some cases, when it persists in that part of the body called the cervix, which is the mouth of the womb, over years, it starts causing damage. And that damage is what you then eventually notice as cancer. The other thing that we also advise is what's called pap smear or liquid-based cytology, or in low to middle income countries like ours, VIA, where you have less accurate, less sensitive, less specific, but it still does the job. So you need to speak to your doctor, your nurses to find out which one you should be doing. But importantly, in relation to cervical cancer, we are beginning to say to people, vaccination against HPV. And it's beginning, Nigeria has just about signed up to make it a national program sometime later in the year. But private facilities, some NGOs in the cancer space have been doing the vaccination over the years, but it's not widespread. Vaccination then means that you're reducing the risk for getting HPV, and even when you're exposed, it can handle it. So this reduces the risk of getting cervical cancer. And you can start as early as the age of 9 to get the vaccination done. So going on to prostate cancer. Now, this is gender specific for the men. The Black man is known worldwide to have the higher risk of prostate cancer and increasingly more aggressive. So from the age of 40 and above, every man should actually see their doctor for the prostate blood test and also for the rectal examination that helps us to feel the prostate to tell how it feels. There's a certain feel to the prostate. So when you feel an abnormal one, you can tell. And then you have the prostate blood test as well. Then last is the bowel cancer, what we call colorectal. And this is both for male and female. Again, from the age of your mid-40s, you should either have a colonoscopy, which is a camera test that is put through the bowel. It's a day. It's not even up to 2 hours and you're done. Or you have the stool test, which can detect if there's blood in the stool, called the FIT. The FIT is not as specific as a colonoscopy. So we always advise people, even if you do the FIT, please arrange to still have a colonoscopy done. And I want to say that all these screening investigations are present here in Nigeria. We have them all. You don't have to worry about, oh, where will I go? Or I have to go abroad. No, these things are happening right here as we speak in Nigeria. So please, you just need to try and speak to the right facility, the right doctor. There are some cancer organizations that have lists of these places where you can actually go and get screened. So it's not just with Lakeshore, there are other places you can get it done. So those are the 4 cancers. What I also wanted to mention about the colorectal is that years ago, Africa, sub-Saharan Africa, Nigeria, we didn't have a problem with colorectal cancer. But as we adopted more Western lifestyle, but mainly diets, the numbers, the prevalence, the incidence, it's rising. So we are beginning to get loads of colorectal cancer, and sadly, in younger and younger people, 20s, 30s. So it must have to do with the diet. You know, we are all eating on the run. If somebody is leaving home at 4 a.m. and getting home at 10 p.m., it makes it difficult to settle down to make yourself nutritious home-cooked food. And we have a lot of eateries, we have a lot of bookers. You don't have control over what people are putting in the food that we are eating. And we have a lot of fast food, processed meat. And so the bowel is changing in the way it handles this food. And what we're doing is changing the whole dynamics of our gut. And that is increasing the risk of colorectal cancer.
Wow, that was so insightful and it was so packed. Thank you so much, Mark, for that explanation. So I want to ask, and I'm going to be asking a couple of questions together as one because of time. Whose responsibility is it to, take control of this screening? Whose responsibility is it to start the screening? And how can we as a society conduct effective and impactful screenings in our society? What can we do to make this happen for us?
And these two questions really, bring us to where we're at now in our environment, in our society, in Nigeria, in sub-Saharan Africa. Whose responsibility? The responsibility is actually joint. It's not just one arm. So you have national, every country should have a national screening program. In the UK, in the US, in Canada, you automatically, when you get to a certain age, have letters sent to you or notifications by email to say your cervical cancer screening is due. Please go to your doctors and do it. And the idea is because the primary care level works in these environments that I've mentioned. Primary care level, meaning that first and foremost, everybody should be registered with a GP or what we call a general practitioner or family physician. And once you're registered, it means that it's automated. It's almost like a centralized system where it's technology, isn't it? Madam Yeti will tell us more about technology and the use of it in data collection. And once you have all this, you're already being split and put in populations. You're 21, you begin to get these letters. You're 40-something, you begin to get these letters. So one responsibility is the country and their ability to develop a screening program and make it work, accessible. The other is the guidelines being drawn up by your different organizations. So the oncology associations, the doctors, the nurses, the lab scientists, that's a responsibility to drive. And then, going into policy making, policies are needed. Bills are meant to be passed to make sure that things are then trickled down to everyone. We don't have that. And finally, there is the responsibility of we, the individual as well, to say, okay, I have received this information. Today, Lagos Moms have organized a webinar that tells me that actually, I don't have to wait to be ill to go register with a doctor, see my doctor once a year or twice a year, depending. It becomes your individual responsibility as well to make sure that you're doing all that. You're going in to have your mammogram, you're going in to have your pap smear done and all. So it's a medley of different, groups that come together to make sure that this is done. And I think it also goes to the next question of impact and, how effective. I think we need to be looking at increasing awareness, increasing education. So Lagos Mom is doing one of the things here. The fact that you're going to promote this, you have a podcast going, you're going to circulate it, is already that education and awareness going on. The government needs to be doing that. Collaboration with radio programs, with the TV to let people know, what it is. There's a lot of myth and what we call myths and misconceptions out there. That means that people don't even want to go to the doctors. So I remember when we did an outreach in one of the markets, and the women then called us and said, please, this mammogram and this pap smear you people are talking about, how much is it? When we told them the price, some of them said, but this is about the amount that they used to buy Ashebi for their friends when they go to support their, their members in the market, that they thought screening was very expensive, unaffordable. When we now explain to them treatment, they now realize that it's treatment which is actually expensive. The actual screening tests, I don't want to mention because different organizations and facilities have different prices, but I can tell you it's nothing like what we spend individually on so many things, so many frivolities and luxuries. So awareness and education by different groups, training in medical school, nursing, lab scientists, everywhere needs to keep being updated. The curriculum needs to be refreshed so that as the years go by, we know what the new information around screening and prevention is. What I knew when I was in medical school, and I wouldn't say how many years ago that was, is vastly different from what I know now. Some basics remain the same, but there's new information because there's research going on, year in, year out, and things continue to change. The other thing that would also help is collaboration, whether it's international collaboration. I spoke to you about World Cancer Day and how UICC and WHO have adopted this, cuts across countries. There's also internal collaboration within countries. So I can tell you now that this morning alone, I've had 2 meetings with, facilities that are interested in the cancer space doing stuff, because we know that we alone, whether it's Lakeshore Cancer Center or our Foundation for Cancer Care, we cannot do it alone. Nigeria is a population of 200 million, and I think that is probably an underestimation. We need each other in the health space to come together to help deliver services, whether it's screening or whether it's treatment. And the more we do collaborative work, the more every citizen in Nigeria can get good care. So, this is not an exhaustive list, but these are the ideas that I have around, impact and efficacy.
So what are some of the challenges and the barriers in our environment in Nigeria to good screening and preventive health measures?
Challenges and barriers. Well, I mentioned one now. It's not my portion, right? But to break it down, we have the lack of education and awareness at all sorts of levels, all levels. And when I say lack of education, I don't mean academic education like, university, because I can tell you there are people who are PhD holders and they don't have that information. So when I refer to education, I mean around the specific information. So that's one. This lack of education and awareness is also within the health space for your information. So it's not just for the public. And that's why Lakeshore Cancer Center and the foundation have been organizing webinars specifically targeting the medical, the clinical, population within our environment, because some are struggling with that information. Then we have the cultural, if you go to the north, it's a different culture. You come to the south, it's a different culture. There are all sorts of, tiptoeing depending on where you are in the country. There are some places the women cannot do anything. They can't go to the doctors without their husband's permission. That delays access, that delays all sorts of things. There are places, even here in Lagos, where someone is diagnosed early for breast cancer and they cannot consent for treatment because they have to ask their husband if they should take treatment, around the, what is, I don't know how to describe it, but you get the picture. It's happening here. It's not just the North where you have those sort of cultural norms. And there are all sorts of cultural norms that mean that there's a delay sometimes, there's a lack of understanding, and that's one of the challenges. The other is the innate fear that we actually have as a people. We're very fearful, population. We go to church, oh my, we go to the mosque, but once you say to someone sickness, death, illness, terminal, we completely lose it. We are very scared of that life cycle of birth to death. And that is one of the things that it stops people from accessing healthcare. Some of them are surrounded by hospitals, but they will never step foot in a hospital because they don't want to know. I don't want to know. So then there's religious. There are many religious institutions here that are a real obstacle to their congregation. It's all or none. they don't see that each element can work together. So we have people who come to us in early stage cancer, and what then happens? They go away because they've been told that they need to come and fast and pray. And 6 months down the line, they go from a stage 1 to a stage 3B. And I can tell you that's like jumping from 90% assurance of being fine after treatment to almost 50% of that. And it's heartbreaking. So we always appeal to the religious institutions that, that kind of rhetoric is really jeopardizing the health of many of their, of their people. Having said that, there are some very progressive religious institutions. And when I say religious institutions, I'm not just referring to Christian, I'm referring to all religious institutions as well. Then, of course, financial poverty. We have a lot of health inequity, financial inequity in our environment. Again, Madam Yeti knows this because there's a lot of financial posts on LagosMums. And, one of it is that we also don't have a detectable insurance system here. So yes, we have HMOs now, companies are paying, but this is for a select group, isn't it? The person down at the market, the person who is hawking, what insurance do they have? If they come down with cancer, who is going to pay for their treatment? So we have that problem, and that's also a barrier. And then we have the issue of information. Where do I refer my patient if I have an issue? Where do I, as a nurse, refer this patient I've just seen? In an outreach environment, where do I refer a patient? And we don't have very clear referral institutions that people can say, okay, this is where I'm going to go. So these are some of the challenges. I must say, some of it is beginning to, from when I came back to Nigeria to now, I can say that the narrative is changing. Very slow, but there are more voices. And, with what LagosMum is doing today, that's one of the voices, really. You become an advocate for doing this because you reach a wider audience as well. And so, yeah, that's the problem. I just wanted to add something. Stage 0 to stage 4, stage 1 to stage 4 is actually how we grade cancer in terms of stages. So clearly, it's better to have early detection at 0 and 1 than 3 and 4. But having said that, it is still not a death sentence anytime you come, because there are a variety of treatment modalities now. That means that even if your disease becomes dormant, meaning that there's no cure, there's quality of life, there are all sorts of things that can be done. So, the message I'm sending out on this particular aspect is, please, cancer is not a death sentence. It is not a death sentence. There is management for it here in Nigeria, right here in Nigeria.
Okay. Wow. Thank you so much, Ma. Thank you. I really appreciate how insightful I, as a person, have learned a lot from the webinar so far. Thank you for sharing with us from your wealth of knowledge. And I know that, like me, there'll be so many people on this call. I think there's a question already to that effect. So many people on this call will be wondering, where is Lakeshore Cancer Center located? How can we reach out to you? What are the rates for screenings? Because that's what we're talking about today. Can you please kindly answer that?
Okay. Thank you very much. So Lakeshore Cancer Center is the first private facility solely catering to cancer education and awareness, diagnosis, treatments, palliation. We have more cancer centers that have come up since we started in 2014. But this has always been our vision and our mission. We started off at VI, off Sanusi Fafunwa, Amodu Tijani. But I'm excited to also mention that in 2022, last year, July, we also opened a new facility in Ikeja GRA, because we discovered that we had almost 60% of all patients coming to VI were actually coming from the mainland. And we've talked about traffic and commute in Lagos. And we just thought we can't be delivering health and not be aware of people's social circumstances. So we opened that facility as well. So we have 2 facilities at the moment, and soon we will also have our radiotherapy unit, which we're going to start building somewhere in Oniru in the next year. So that's location-wise. We are very active on Instagram at LCC Cares. We have a website. If you go search for us, we are on Facebook. I think I've given Nifesi some of the handles, so she'll be able to also post that later. We also have a foundation, which I mentioned, and the foundation has been very active for the past 18 months. It's called Foundation for Cancer Care. And in the past years, the whole of 2022, we rendered radiotherapy to about 8 patients. We also did a lot of screening. We had a drive last year for about 400 women, free mammogram around Lagos, in addition to other things the foundation has been doing. Currently, we are offering for anyone who comes through LagosMums for the next 4 weeks, a discounted screening at either of our facilities. So it's 30% discount, which means that things like breast examination will actually be free. And, there are all sorts of reductions as well for cervical cancer screening, for PSA, for the men, for FIT, that's stool tests, for the bowel screening. So please, by all means, reach out to us, and there will be someone to help you navigate the process. What we don't encourage is walk-in, just because we use an appointment system. So we don't really keep you waiting. If it's a day that we are really very fully booked and you turn up, we don't want you waiting for so long, because it's screening and it's not treatment. So what else have I omitted there? So the promotion for LagosMums will end 31st of March. But having said that, please, after the promotions ended, still come visit us and have your screening done. Like I mentioned, screening on its own is affordable. The problem is getting into that phase where you left it too late and you've come in for treatment, and that becomes a bit of a financial burden.
Okay, wow. Thank you so much, Ma. So Lakeshore Cancer Center is offering members of our community at LagosMums a 30% discount on screenings. So if you're on this call or you'll be watching this later, you can as well reach out to us at LagosMums, or you can reach out to Lakeshore Center. Their Instagram handle is at LCC Cares. So I dropped that in the chat box. You can also reach out to them via the website. That's www.lakeshorecancercenter.org. So you can also reach out to them there. So this discount will cover for anybody once you reach out, whether you're a man, a woman. Once you reach out to Lakeshore Cancer Center, or you reach out to LagosMums, at LagosMums on Instagram, at LagosMums on Facebook, on Twitter, and on our website, www.lagosmums.com. If you reach out to us, you can get any information about how to contact Lakeshore Cancer Center. And we would also have their numbers. I'm going to drop that in the chat as well. So if you need that, please don't hesitate to reach out. Or when you contact us, we'd also share that across our various platforms so that people can have access to Lakeshore Cancer Center. So their address is Lakeshore Cancer Center. They have 2 locations. One is at Victoria Island, Lagos. Number 14, Amodu Tijani Close, off Sanusi Fafunwa Street, Victoria Island. I'll take that again if you're taking notes. Number 14, Amodu Tijani Close, off Sanusi Fafunwa Street, Victoria Island. You can also contact Lakeshore Cancer Center at Ikeja, number 5B, Oduduwa Crescent, Ikeja GRA. Again, number 5B, Oduduwa Crescent, Ikeja GRA. Please note that there's a time lapse for taking advantage of this generous discount. You have to make sure that you reach out to them starting today, February 27th, 2023 to March 31st, 2023. So they have been so generous. That's over a month and a few days. So you're able from now, February 27th, 2023 to March 31st, 2023, you have access to take advantage of this 30% discount. And make sure that when you reach out to them, when you call, you can just make sure that you mention Lagos Mums. So once you say, oh, I'm so-and-so calling from Lagos Mums, I heard about a discount during the webinar or when I watched a video on YouTube or anywhere, just Lagos Mums, and you would get an appointment date and you would also get advantage of the 30% discount. So thank you so much, Ma. Thank you so much. And one thing that you can also notice that Lakeshore Cancer Center offers an annual general health screening package. So if you are also interested, you can take advantage of that. Thank you so much, Dr. Oge, for being here. I learned so much from this webinar, and I cannot wait, like many other persons here, to watch this replay so that I can go back to listen to everything that you have said. Thank you so much, Ma. Thank you, everyone. If there are still any more questions, okay, we've taken the questions here, and I don't think, let me go through the chat. Yes, that's all for now. Thank you so much. Have an amazing day, Dr. Oge. Yeah.
Thank you, Lagos Mums. It's been a pleasure.
Yes, and don't forget, you can reach out to us. I've mentioned that on Lagos Mums across all our platforms at Lagos Mums, LAGOS, without space, MUMS. And you can also follow us. You can also go through our website if you want to contact us. Lagos Mums, www.lagosmums.com. Please note, the Mums is spelled MUMS. It's not MOMS. And the Lagos and the Mums is without space. So thank you so much, everybody. Thank you for joining us. Have an amazing day. Bye.
Thank you. Take care. Keep safe.